Hi there, my name is Wendy Cress and I'm interviewing Dr. Wicker, who's a radiologist. Hello. Say hello, Dr. Wicker.
Why, hello there, window.
Okay then, my first question. How long have you been working with radiation?
Well, I've been working with radiation for almost 7 years.
Oh, and have you discovered any health issues related to the radiation you work with?
No, not yet.
Did you have any classes in college just for radiation and its hazards?
No, in college pre-med courses do not include discussion of radiation as it relates to medical practice. There is some coverage in medical school. In-depth review of this subject is limited to a few specialities that deal with radiation on a daily basis. That would primarily be radiology, which I practice, and radiation oncology. Radiation oncologists are different specialists than radiologists. They use radiation to treat diseases, whereas radiologists use radiation to diagnose disease and occasionally guide us during interventional procedures. Other specialities, such as interventional cardiology, also need to use radiation in their work, and they receive training as well.
Well, hello there. Are you frequently asked questions from patients about the radiation or the amount of radiation they receive from different machines? If so, what are some questions you have received? Well, I am asked questions surprisingly infrequently. One of the reasons for that is likely that a great many radiologic exams are performed by a technologist and later submitted to us for review. The technologist positions the patients for the X-ray, controls the CT or MRI scanner during the exam, etc. We frequently never see the patient who was examined. I would imagine the patients are more frequently asking the technologist these type of questions. In my practice, I do see patients throughout the day and occasionally get this type of question though. And usually the questions are somewhere along the lines of, will this cause cancer? Oh, okay. How many machines do you work with that use radiation?
Well, the primary machines we use to diagnose disease that employ ionizing radiation includes radiography, or X-rays, computed tomography, which is CT or CAT scans as it is known, a mammograph, fluoroscopy, and nuclear medicine.
What sort of treatments do you use that involve radiation? Radiologists do not use radiation to treat patients, actually. Radiation oncologists treat patients with radiation. That's so interesting. How many other doctors at your hospital work as closely to radiation as you do? In addition to radiologists and radiation oncologists, many other physicians use radiation in their practice. Interventional cardiologists use fluoroscopy during their procedures, especially cardiac catheterization. Many surgeons use fluoroscopy briefly during their procedures. Oh dear, interesting. What advances within the last 50 years in radiology have made diagnosing patients easier? There have been incredible advances in imaging over the time period. The development of the cross-sectional imaging, ultrasound, CT, and MRI has allowed us to see inside the body to diagnose disease as well as rule out injury in a way that was an exploratory surgery can be scanned for a quick CT exam. We can tell ER physicians and surgeons if there's any reason to send the patient to the OR or not. What advances in radiation in in the last 50 years has made diagnosing patients easier. Advances in the equipment have resulted in faster scan times with less radiation exposure. Faster scan times are good because patient motion degrades image quality, and there is less patient motion the faster the scan is completed. What safety equipment are you required to wear? I wear a lead-lined apron and a thyroid shield when I'm performing fluoroscopic exams. Some of the interventional radiologists who are exposed to more radiation also wear special protective eyewear. And we all wear radiation monitoring badges, dosimeters. They are periodically submitted and checked to verify we are not being overly exposed to radiation. How much radiation are you exposed to in a year? I'm not sure, but it is well under the yearly allowed amounts. Do you recommend radiology as a future career for someone? Oh yes, I think it is a very rewarding career. It does require a big time commitment, 4 years of college, 4 years of medical school, and 1 year of internship, and a 4-year radiology residency, and usually a 1-year fellowship before you are finished with training. As the volume of imaging has grown exponentially in this country, the days are extremely busy but always interesting. 20 years ago, radiology was considered a lifestyle specialty, but I would say those days are gone simply because of how many exams are being ordered. That's okay though, because we have an opportunity to make a difference in the care of so many patients on a daily basis, and that brings a great deal of satisfaction.